Yes, it's no secret. Our kids are on drugs. But what drugs, you ask? Prescription drugs that are supposed to help with their homework. Students with ADHD have turned to a prescription drug known as adderall, commonly referred to as addies, to keep themselves focused. But students nationwide continue to ignore the negative health effects, putting good grades above good health. I talked to local pharmacist Nicole Pagano to find out what addies are all about.
If they took the drug as it was prescribed, it could cause, the adderall and Ritalin can cause weight loss, increased heart rate, increased blood pressure, things of that nature. When people are really taking excessive amounts, or they're not taking it orally, they're injecting it or snorting it or things like that, it can cause heart attacks, strokes, really high blood pressure.
Yes, it all sounds quite awful. But there are students like Neil Goodman who take the drug responsibly.
Hearing other people talk about it, and then I was like, oh, hey, wait, I might need that.
College students are more aware, but by then, if you've been using it all through high school, by the time you get college age, you're just addicted.
But how do we determine which students actually need the drug and the students that just want to take it to have a good time?
Oh, I definitely think if we were able to share information more freely, HIPAA, I'm sure you've heard of HIPAA.
HIPAA is the Health Insurance Portability and Accountability Act, passed in 1996, which ensures that an individual's health information is kept private. But Pagano says that this law gets in the way of communication between doctors and pharmacists, which helps ensure that patients are actually getting what they need and not just getting what they want.
It's a great law in its intention, but a lot of times it gets in the way as far as, communicating with other healthcare providers.
But the question still remains, how do we get our kids off the drug?
The advice I would give people is that if you have ADHD and you really are having trouble focusing, then you need to leave it to you need to voice that concern to your doctor, and you need to let him handle it, because none of us are doctors, and there's a lot of information that's spread, and some of it's true, most of it's not, and that's why we pay the professionals.